Dr. John Lowe, if you can please tell us a little bit about yourself.
Greetings, Ashley. So thank you so much for the opportunity to talk. My name is John Lowe. I'm faculty in the College of Public Health at the University of Nebraska Medical Center. I'm Assistant Vice Chancellor for Health Security at the University of Nebraska Medical Center and have oversight for safety and infection prevention in our biocontainment unit and the National Quarantine Unit, and run a number of national and international programs focused on infection prevention.
Great. Oh, you are exactly the person we need to talk to. Uh, so there's just so much going on right now, so many conversations. What does the research tell us about the use of masks to prevent the spread of COVID-19?
Absolutely. So the research really tells us that there's a number of ways we have to think about and consider the use of masks. So not all masks are created equal, and we use different types of masks to provide different levels of protection. So what that means is, there's kind of two focus areas in the use of masks, and one is so using a mask to protect the wearer
Mhm.
from infection risk of others. And then the other area is really focusing on using masks to, as what we call source control, which
Mhm.
is, to limit the amount or the potential that someone has to infect others. And the mask in that case generally isn't providing the wearer much protection, but it's protecting all of those around them.
Exactly. I think about the different reports that cities and countries that adopted mandatory mask orders kind of early on, they have more success flattening the curve. Would you say that's right?
It's absolutely right. So, our counterparts in Asia have been using widespread mask use in public much longer than we have in our hemisphere. And in large part, that's based off of the lessons that have been learned from previous influenza and the first SARS coronavirus. So yeah, there's definite evidence from countries that implemented widespread masks in public. Again, those are primarily focused on source control. But
Mhm.
for this particular illness, which we've only known for about 6 months, so we learn more by the day, by the week. But what we're seeing is in some communities, up to 60% of the people that are infected have no symptoms,
Yeah.
no apparent illness, but they are just as effective and efficient at infecting other people as those individuals that have, pretty severe illness. So this is where the community masking comes in, to where if you can have everyone or a large proportion of the population wear a mask, then we're reducing those people that are unknowingly infecting others.
It's that's definitely the part that makes it even more scary than it already is. You mentioned earlier about having the mask not only protect the person that wearing it, but more so the people that they may come in contact with. If you can just expand on that a little bit more, because I've heard of an example, but I'm sure you have an even better one. But the example of a bicycle helmet or a seatbelt protecting the wearer, which seems to protect the person wearing them. Can you talk a little bit about the difference between the protection? Can you dive in a little deeper on that one?
Absolutely. So the way this works is, we kind of look at three types of masks that people are wearing. You have your cloth masks, which are made from fabric similar to our clothes are made from. We have a procedure or a surgical mask, which is more, they kind of look like a paper-based mask, but what you would see, be more likely to see in a hospital environment. And then you have an N95, which is a mask that is generally used in healthcare or other environments that is actually referred to as a face piece filtering respirator,
Mhm.
but generally affords the wearer a great deal of protection. So the way that those three groups of masks work is that cloth masks and face coverings are really focused almost solely on source control, are not necessarily going to provide the wearer a great deal of protection, but will definitely reduce the amount of droplets the wearer is exposing other people to. Um, Cloth mask effectiveness is, there's also degrees of cloth mask effectiveness. So what research has shown is that, a single layered cloth mask is kind of on the low end of effectiveness. It'll probably block really large respiratory droplets. If you've ever been speaking with someone and a large droplet of spit comes out of their mouth and you kind of watch it fly towards you, it would likely block something like that. But other things, not so much, or to a less degree. And if we get to a mask that's constructed or made with 2 layers or 3 layers, we see its effectiveness at capturing the particles that someone is releasing to others. Really, really much more efficient if you have a double or triple layer cloth mask. And then we go to the procedure or surgical masks, which are very effective at capturing pretty 70% of the particles that an individual puts out into the environment. This is why we adopt them with surgeons, right? So surgeons are it's a perfect example of how we'd like to do source control. We don't want a surgeon to infect the individual that they're operating on. So we have them wear these surgical masks. It does a great job of containing what may be respired by the medical providers there. So they're more effective at capturing things coming out of the mouth, and they also start to afford the wearer some degree of protection. So surgical masks and procedure masks have a fluid resistant coating on the outside. So that means that if you're interacting with someone who's putting out particles, droplets or smaller particles, that fluid resistant coating on a procedure or surgical mask is actually going to repel a larger proportion of droplets and will definitely propel larger droplets. And then when we focus on N95s, again, these are filters that have been made to wear on your face, very effective at protecting the wearer from 95% of particles, and also provide really great source control. The difficulty with N95s for the general public is you generally have to be fit tested to the appropriate size respirator for it to work for you.
I see. And most people wouldn't have access to be fitted for one of those masks. Okay.
Yeah. So the other thing that is really important, Ashley, is there's a lot of talk about herd immunity, and once the majority of the people in the population have been infected with SARS-CoV-2, will largely be protected, right? We are well away from that. The latest estimates are about 10 to 12% of the US population has been infected, which means even though we've seen some pretty stark, amazing examples in New York and Florida and Texas about just the burden of this disease on those populations, that's only representative of about 10 or 13% of what we could see. There's still 87, 90% of people out there that are susceptible to this. So what we can do immediately right now to reduce the risk to the entire population is do source control on as many people as possible, which reduces the number of people that someone who's infected and doesn't know it will put at risk.
That absolutely makes sense. So I have a question for you, kind of through like a social lens. Some people of color have spoken out about how the experience of wearing a mask changes based upon your skin color. For example, it's been reported that Black people and Chinese people are more likely to be racially profiled and or stereotyped as being sick for wearing a mask in public compared to Caucasian or white people. Can you talk about how we might address this element from a public health perspective?
Absolutely. So this is a really critical and important issue. It's also an issue right now where we're dealing with, at least to date. I think this trend and the dynamic may shift, but to date we've got this immense burden of this particular disease really hitting a few communities exceptionally hard.
Yeah.
and this is largely our minority populations and immigrant worker populations have just been, really significantly impacted by this. So, this is something that we're exploring on a number of ways, and I think is really important for us to address. Um, and I don't have all of the answers on this. That is for sure. But I think as we work through and start to accept as the broader community the place that masks hold in this pandemic and the
Hmm.
value that they have, and we start to see more widespread adoption of masks as a prevention and control measure, that that level of um, misinterpretation of people wearing masks will decrease. But admittedly, I think we're a long ways from that, right? So you're calling me to do this interview today because there's such a widespread debate about whether or not we should wear masks, whether or not they should be mandated,
Yeah.
and really driving that personal choice. So um, I think that that's a crucial issue. I was traveling internationally when COVID broke out in January, and
Oh,
was in
really?
large international airports when it was really starting to catch the world's attention. And I can tell you that I observed firsthand, if you happen to be an individual of Asian descent wearing a mask in one of those venues, it was palpable and just stark, how others around would either overtly or inadvertently respond to those individuals. So, and to your point, I think over time this is transitioned based off of the disease demographics in the U.S. to where we've had different populations really significantly impacted, and so that false attribution uh, of of individuals in those groups wearing a mask presenting a risk or a hazard is just really unfortunate. And again, I think is something that largely stems from, one, the racial inequities that still exist today, and two, a lack of a widespread understanding and adoption of the value of masks.
Absolutely. It's so much to unpack here. We've covered so much in just a little bit of time. But I want to thank you for allowing me to interview you this morning. I know we kind of was able to connect kind of quickly, and I want to thank you for diving into it, letting us know more about what the science tells us, what we can do to help protect ourselves and others, and also letting us know the implications that wearing the mask have. So thank you so much for this interview, Dr. Lowe, and thank you, Noise listeners, for tuning in.